And as Ken mentioned, my original background is primarily in orthopedics and manual therapy. So for someone that was trained very much so in the manual therapy field and not necessarily relying on technologies like the Winback or like Shockwave, coming into the Hopkins family probably 7 years ago now and seeing all the technology really tested my thought processes on how to manage patients effectively. And I would say since the implementation of all the various technologies that we have, but specifically TechR, I found that a lot of the complicated patients that are funneled through me and through Ken to me, the Winback has definitely played a vital role in my treatment approach when the appropriate patient's identified. So these next several slides are going to kind of go over kind of my clinical decision making and how I personally utilize the Winback, which might be different from the likes of Jen or David or Maddie, which I think speaks to the creativity that the device allows and really lets the mind wander in application to a wide variety of musculoskeletal, whether pelvic floor to all the way up to the hand and everything in between. So the specific patient that I'm going to talk about this evening was a female runner physician that was referred to us from our PM&R colleagues that was complaining of bilateral calf and a diagnosis of Achilles pain. So we're going to kind of go through some of the subjective, the objective, a few things that I picked up on and noted on, and then getting into kind of where the implementation of Winback started, the response, some of the techniques that I used with this individual. And, this is an ongoing patient that I'm working with. So the responses early on have been beneficial and positive, but the final outcome is to be determined at this point. But to kind of get it started, she was a 50-year-old female who hadn't been running since earlier this year in August, completely shut down all activity because at this point, even walking or standing for a prolonged period of time, working with patients was becoming difficult because of her complaints of calf and Achilles pain. Upon further asking, she really reported bilateral Achilles, medial arch, and calf pain. But really, we were focusing a lot on the right side to start and then potentially progressing to her other complaints. Because really the right side was where a majority of her symptoms were. She was complaining of Achilles tendon plus this lateral ankle pain and calf tightness. And that's really where this case is going to be focusing on, like I mentioned. So really upon, getting a better understanding of her symptomology, her onset, really looking at the objective component, I started to see some changes in her range of motion that you might expect in an Achilles tendinopathy. There was a decrease in muscle power output with handheld dynamometry testing. A lot of our testing within our departments, we're really moving away from manual muscle testing as much as we can and really trying to get that objective measure to really put a number to the output of the strength that our patients are starting to see. But then, palpation really showed a classic Achilles tendon with some increased inflammation in and around the Achilles, that observable thickening of the Achilles, and then some trigger points in and around that lateral gastroc. And then as you see this next bullet point, this is kind of where my evaluation really took a turn in the regards of thinking, is this truly muscle or is this more of a neurodynamic nerve-related complaint? And what I really started to see is that she had some positive sural nerve findings, specifically kind of with Tenel's and then with reproduction of straight leg raise with a bias into that sural nerve, which we can do by incorporating some inversion and dorsiflexion at the ankle, along with some long sitting slump being positive. And then further looking up the chain, I started to notice some thoracic hypermobility and some lack of range of motion through that area as well. So kind of looking at the chart here, I kind of pulled this up to her and explained to her kind of like, is this where you're feeling some of these symptoms? And she was like, this is this is spot on where those symptoms were. But I still wasn't fully, certain about if it was sural nerve or not. I still wanted to, really rule out the Achilles tendinopathy. So that's kind of where I started. As Ken mentioned, we really try to take a multimodal approach in regards to therapy. So I really didn't even think about using Winback right off the bat, because I thought I found some impairments. I saw that the pterocrural joint was hypomobile, the thoracic spine wasn't moving well, and then there's some neurodynamics that we were going to address through some of our my manual therapy background. But then I also like to incorporate another device that we have, which is a myoacoustic compression therapy, which is similar to shockwave, which tends to get fairly good results with a chronic Achilles tendinopathies. And then incorporating with her being a runner and looking at proximal hip strength as well, I wanted to make sure that I'm giving her everything that she could utilize, because I'm working with her once a week, once every other week, due to scheduling, her schedule, my schedule. So really trying to set her up for success in between, patient visits. So also incorporating some thoracic mobility and then some self-neurodynamic mobilizations, focusing on that sural nerve. So really within that first 1 to 3 visits, I guess day would be the wrong term for this, but over the course of approximately 3 weeks, I started to see some increases in activity. So a positive response to what I was doing. So she was going from avoiding any type of exercise, such as walking outside of work, to now walking 3 miles daily with minimal complaints of pain, along with returning to her Peloton, where before that was really giving her some issues through the calf and the Achilles region. And now that's starting to become pain-free as well. But however, like most things, patients can sometimes come in and start to have new complaints of issues. And that's kind of really where I started to take a step back and think, what else could I potentially add? Because now she's starting to complain of more focal symptoms through the calf as things started to clear up through what I was already doing. And she started to complain about, sharp pain, specifically at the lateral ankle, but then also she continued to feel this need to massage with the tennis ball, with her hands, with a Theragun, kind of her lateral gastroc, to the point where upon observation, I even see isolated bruising based off of how much she was trying to massage that area. So that kind of really cued me into like, all right, what's going on here? Is this truly muscular, or is this more of a nerve entrapment that's being reproduced as an Achilles-like issue? So when I start to think about incorporating the Winback, I really kind of take it at a stepwise fashion. So I'm really looking at, I want to start by preparing the tissue with the utilization of the Winback. And then once the tissue is prepared, warmed up, then I want to go into loading the tissue and really trying to work on stressing the tissue in a relatively pain-free manner. And then once symptoms continue to improve, our goal as rehab therapists or chiropractors or physicians is to really get them back to, active exercise, active loading, trying to replicate their demands throughout the day and the demands that they might have from an exercise standpoint, an activity standpoint. So this is what's going through my mind whenever I turn the device on, and that's what we're going to kind of go through here and touch on. So really the next day that I decided to use the Winback, what's nice about, we were using the Winback, not the Winback 4, because this was prior to the placement of the new device. I was using a lot of soft tissue. I asked them, using the bracelets in combination with my hands, with instrumented soft tissue tools, really trying to work in and around that gastroc, the Achilles tendon, and specifically focusing on the sural nerve pathway, and trying to increase blood flow to the area, decrease any type of adhesions, myofascial restrictions, decrease muscle guarding, really trying to clear up the system from the knee down. And really here, what I'm showing is just kind of my initial tissue preparation using the CET device, anywhere between 0 up to 40%, starting low, gradually increasing the intensity while maintaining a low pulse, which tends to be more comfortable, and then following that back up with RET, really trying to get into more of those resistant like tissues, allowing the frequency of the device to work its way through and along the nerve path. So what you don't see is where the ground plate is, which the ground plate that the current will travel through is located up at her distal thigh. So really trying to just get, not only through the ankle, but all the way up past the knee potentially as well. And really, the response there, kind of my retest that I do, I start to see some improvements in her ability to tolerate a straight leg raise, a decrease in symptoms, an increase in ability to walk without pain. So that's kind of telling me that I'm on the right track. So, as I continue to progress through my patient care, I want to try to incorporate some active movement, some loading of the tissue in a relatively pain-free range of motion. So I'm been really focusing. I'm a nerve guy. I tend to think the nervous system plays a pretty large role in a lot of our musculoskeletal like complaints. So I start looking at how can I incorporate the Winback with my interventions that the patient's doing within the clinic. So really looking at, some supine neurodynamics, having the patient actively go through, some nerve glides as the device is on. So as you can see here, instead of having the bracelet on myself, I actually place it right along the lateral ankle as close as I can to where she was complaining of pain. And with the bracelet, I'm allowing the RET to travel through the ankle, and then it's passing through all the tissues up to where the ground plate is. I apologize for the video not playing smoothly, but as you can kind of see here, she's just going through the motion. With my neurodynamics, I like to do kind of higher repetitions, really trying to just improve mobility, not only within the nerve, but the container that the nerve is traveling through. So, I'm not only getting some nerve involvement, but also localized muscle recruitment as well. And then from there, I also like to incorporate, some things in sitting. So another modification that I might have the patient do, where the ground plate itself is now higher up through the thigh. So I'm getting the entire limb itself. What they might report is some localized heat where the bracelet is, but they might start to feel, warmth at proximal sites to the bracelet where the frequency is starting to intensify or start to focus where the greatest resistance along the path is. And I found that with the specific technique, I'm able to take what I usually do, more so just having the patient do, but taking it to the next level. And the response so far has been pretty excellent. So, after that, I'm thinking, what else can I do? How else can I stress the system starting to improve? So therefore, I'm like, well, let's get them up and standing. I try to do some loaded neurodynamics and standing, really stressing the entire system. So now I'm trying to bring in the thoracic component to really try to increase the strain through the system. So as you can kind of see here, the patient's bending forward, with the knees bent, and what you might see is she's trying to lift her tailbone towards the ceiling, and then she's offloading through the head before she comes up. And the patient would report, an increase in symptoms as she's bending forward with the chin tuck, but as she releases the chin, the symptoms start to improve. So I'm starting to try to prepare her for more of a loaded like intervention, such as, body supported treadmill running, some jogging, some elliptical work, general exercise and standing, and really trying to just stress tissues to the max as best I can with what I have in the clinic. And really, again, I'm focusing on that RET between 30 and 40%. With the Winback 4 now, there's a built-in component where I can actually increase this even higher. and there's a safety component where it's going to regulate how much intensity is actually being placed through the system, which I find is going to be very helpful in the near future. And typically, I'll do this here. The time says 20 minutes. I probably cut it short around 15 or so, just from a time standpoint. A full treatment session could probably take 15 minutes before, we move on to something else, and working outside of the confines of the Winback itself. So really, from there, I'm looking at active loading. So again, proximal hip strengthening. She's now working on calf strength training. Everything's improving, no complaints. What was previously painful, such as the elliptical, she's now complaining of no complaints of acute pain. The most recent visit that we had prior was now walking, and she even attempted to do some light jogging without difficulty, reporting zero pain with some light jogging. And I'll preface that with, this was without me telling her to start jogging. So her feeling, well enough to be able to actually start on her own is very encouraging to me. So, at this last visit, her telling me that kind of led me to think, all right, I feel like we're ready to start progressing some running. And that's where we started to use kind of our Ultra G or Boost anti-gravity treadmill, and started to let her do some walk jog progressions at a decreased weight, also providing her some education on how to incorporate that outside of the clinic as well. So, with that said, that's kind of the end of that case there. I think it just kind of demonstrates a nice progression from a passive treatment that tends to be relatively easy, to now thinking about what all can you do from a creativity standpoint with the device. And I'd be happy